once again, this is the Big Ideas Theater at AARC Congress, and I'm joined by Marc Schlessinger, and we're here to talk about patient safety and alarm fatigue. Obviously, it's a big problem. There was the study that was done back, I believe, 2014 you'd mentioned. So kind of where do we stand now?
So the Joint Commission released their initial alarm patient safety goals for alarm fatigue in 2012. It was added to in 2014. We've been working a lot on alarm management and alarm fatigue since then. However, we have still seen many patient adverse effects due to alarm fatigue in the hospital setting and also in subacute settings.
What's an RT to do, so to speak?
So I think the best thing for RTs to do is to make sure that the patient ventilator alarms and the BiPAP alarms, et cetera, are all set specifically to that patient.
Now, can you get some thoughts, if you could speak directly to the manufacturers about how they could help the situation?
I know the manufacturers are working on things, and they are truly hand-tied by the FDA, which we understand. However, one thing that I think would be very beneficial on all ventilators would to be able to add a 5-second alarm. Many alarms, some say between 85 and 99% of all ventilator alarms are non-actionable. A non-actionable alarm means if nothing's done, if a caregiver does not intervene, the alarm corrects itself and there's no patient harm. So a 5-second delay in that alarm would decrease alarms by about 60 to 65%, which would be extremely substantial.
It sounds like it would be. And again, getting back to the RTs themselves, I mean, we're only human. I mean, there's only so many things you can do, and you can't just walk away from the patient. You can't take a break in the middle of the day necessarily to try and clear your head. Have you found any personal techniques that might help you out?
Unfortunately, alarm fatigue affects all caregivers, RTs, nurses, physicians, et cetera. And what happens is you become immune to it, and that's what alarm fatigue truly is. Taking frequent breaks is as frequent as you can take. Hospitals are very busy, staffing is limited, so when you can take a break out of the unit, that does help.
Well, Winter mentioned that you're going to be doing a specialized class on this for credits. So maybe you can tell us a little bit about, some of the things that will be discussed in your class?
Yeah, I'm going to be tomorrow filming a 1-hour CEU presentation for the AARC that they will be distributing at a later time that will give CEUs on alarm fatigue and alarm management for those who are not able to attend Congress.
So you get the latest insights and tips right from the source there. Fantastic. Marc, thanks so much for coming by.
Thank you.
And once again, this is the Big Ideas Theater at the AARC Congress.